Welcome to this Nocturnal fitting guide video. In this video we're going to discuss contact lens collection and handling of the lenses. I'm Scott Brown, optometrist at Scotlens. So there's a main difference between a collection appointment with day lenses and the night lenses, and that's the fact that we're not really particularly interested in the fit of the lenses. The fit's going to be shown by the topography after the patient's worn them and the cornea's responded to the lens wear. So the main point really for the collection appointment is to spend time with the patient, getting the patient really comfortable getting the lenses in and out. So we're going to do the teach, we're going to assess the lenses, provide the written information that comes with the lenses, and then we're going to schedule a review. Typical review for a new wearer would be after night one, then about a week to 2 weeks after wear, and then a month, and then follow up when you replace the lenses either 6 monthly or annually. So obviously for collection, instruct the patient to wash their hands. It's useful to get them to transfer the lenses out of the mailer into the contact lens pot with the multi-purpose solution. And then a really useful thing is to apply a drop of anaesthetic into the eye that the patient is going to practice with first. This is really useful for any GP lens. In fact, it gives the sort of positive first impression and leads to 4 times less dropout with GP lenses, just using anaesthetic for this first time the patient's going to experience the lens. But again, the purpose of this appointment is for the patient to be comfortable getting the lens in and the lens out. The comfort with the lenses, when you've closed your eyelids, is fine. There's almost no lens sensation with your eyes closed. So the patient's really just distracted by the lens if they've got the lens in their eye without anaesthetic. Instill anaesthetic, get the patient to put the lens in and out a good 3 or 4 times with each eye. Often if the patient's good with handling, I won't use anaesthetic for the second eye, and I may practice that less if they've got the hang of it with the first eye, but certainly use anaesthetic for the first eye. Insertion is just like any Gazprom lens. We need to put a drop of solution into the lens before we put it on the eye. Patient looks forward, looks down, places the lens straight onto the cornea, and then removal is ideally with the tiddlywink method. And if patients are struggling with that, again, I would then use the contact lens sucker for removal. But the contact lens sucker is provided in the case really for picking the lens up if it's dropped onto the lens, onto the counter or onto a mirror. It's to prevent lens damage. Once the patient's got the lenses in, we are going to have a quick look at the lenses. We're not really interested in how the lenses fit, particularly because this is the open eye environment. Of course, lenses are designed to fit in the closed eye environment. So you can see we've got 3 different images here. The image on the left, this is an optimum appearance. This is how we'd expect the lens to look. So we've got a classic sort of fluorescein bullseye pattern. Useful information is in this middle image where we've got the patient's got a bubble trapped underneath the lens. So that can be an indication that we need to do a little bit more practice, insertion removal. Ideally, we don't want the lenses to go in without a large bubble like that. That bubble could break up during the night and leave the patient with dimple veil and blurred vision the following day. And then the lens on the right, this is a good fitting lens, gave an optimum correction for a patient, but you can see the fluorescein image is quite different from the image on the left. You can see it looks like we've got too much apical clearance, but actually this is the indication that the lenses fit different behind the closed eyelid because this was a successful wearer. You're then going to schedule your review appointment, so the patients, you can see the patient after they've worn the lens. I tend to get patients to remove the lens when they wake, because if they keep the lens in on the way to the appointment, the lens sits in the open eye position and it usually just causes distortion and lower acuity. So I instruct my patients to remove the lens when they wake. You're going to try and review them a fairly early appointment for review. And at that point, lower myopes will have woken up fully corrected. Higher myopes will probably have woken up 3/4 or almost fully corrected, but it fades off quite quickly on the first day. So you'll be expecting to see a slight undercorrection. The main thing we're really looking for is to discuss how the patient experienced the lens wear for the first night, check their acuities, going to do a slit lamp assessment, and then a topography, which we'll discuss in a later video. So if you'd like to learn more, keep watching the video series. Any questions, contact lab@scotlens.com, and thanks for watching.